What needs to happen to pick up the pace of vaccinations in the United States?
I think one of our biggest challenges right now is communication. So, in that last step where the vaccine shows up at the healthcare systems or at the states, we need to have a good sense of what's coming and when. And so, we are, healthcare systems and state health departments are used to distributing and providing vaccine. But the pace of this and the unknowns of this and the cold chain storage issues around this vaccine, particularly the Pfizer one right now, are larger and more challenging than anything we've ever dealt with before. So we have to make sure that every step of the way there's communication. What number of vaccines are coming? How long will you have to distribute them? What is the cold chain storage process for each element of the vaccine? And making sure that the people on the end, that last mile, the people who are being charged with delivering those vaccines understand exactly what they're going to get and the timeline in which they're going to get them, because that is critical to making sure that they have the staff to distribute them, the space to distribute them, and all the additional resources that come with distribution.
Lauren, the UK has this morning approved the AstraZeneca Oxford vaccine, a vaccine that can be kept in the fridge, that is stable for a very long period of time. How big an impact would such a vaccine in the United States have? You talk about the super low temperatures that particularly the Pfizer vaccine has got to be held at. How big a problem is that cold chain? You mentioned it just a moment ago.
Yeah, I think the cold chain storage is a challenge, and part of that is because it's a process that is just not something that we normally use. So the infrastructure was not already there prior to distributing this vaccine broadly. There are places that have the infrastructure in place, but they're relatively few compared to what we normally deal with. The Moderna vaccine has fewer cold chain storage issues. So what we're hearing is that places that have had challenges with getting the ultra low freezers or getting being able to distribute the large number of doses that come in the shipments of Pfizer are going with the Moderna, and then the Pfizer vaccines are being allocated to places that can manage the process a little easier. The AstraZeneca vaccine and some of the other ones that are a little bit further in the pipeline, or not as far in the pipeline, sorry, have fewer cold chain storage issues. And I think that will be huge, not just in the US, but globally, where cold chain can be a real challenge. So I think we're excited to see, we saw the reduction in the challenges with Moderna, and we'll continue to see that in some of these other vaccines that are coming down the pike. It'll be really important for getting vaccines ramped up broadly across the globe.
Lauren, we have now seen a reported case of the UK variant, which is more transmissible. I think it was in Colorado. How big a source of concern will this be? And would you expect this virus variant now to have a significant impact in the United States?
I think we were all expecting to see it. We didn't know where it would pop up on our sequencing data first in the U.S. But it's interesting to call it the UK variant, because what we're really seeing is that the UK first detected it because of their exceptional sequencing processes and the volume of samples that they process through those pipelines. As you can see, we're sort of seeing it all across the globe, and this Colorado case is just the first one. It's interesting that it's in a person with no travel history, which means that that case probably came from someone else, which means there are probably many more that we just haven't detected yet. So I think as we start to see the backlog of sequencing data be added to some of these databases, we will see many more of these cases. The transmissibility is definitely concerning, even if it is not more deadly, or if it's not causing worse or more symptoms. I think everyone is concerned by any variant that shows increased transmission, because that ultimately at the population level is going to mean more cases. And more cases is something our healthcare system just can't really manage right now. We are strained across the country. We're strained in many situations across the globe. And so hopefully with more data on this strain on this variant with increased transmission, we'll also see a push towards re-upping our commitment to those those interventions that allow us to stay safe. So masking, social distancing, all of those things that we've been hearing for so long continue to remain important. And the vaccine is giving us a lot of hope right now, which is really exciting. But ensuring that we protect our population, especially our vulnerable population that may not be able to access the vaccines right away as we ramp up scale, it's going to be hugely important to keep those measures in place.